Without further ado, I'm happy to hand things over to our global health solvers, starting with Visilant, presented by Jordan Schuff.
Hi, everyone. I'd like to bring your attention to your vision. Vision loss is devastating. Close your eyes and imagine going through the rest of your day, navigating the New York City Metro to get back to your apartment, taking your kids to the playground and watching out to make sure they're safe, going to our networking session and finding the face of your favorite solver to connect with. Our vision affects the way we earn a living, the way we learn, and the way we connect with others. However, 1 billion people live with preventable vision loss. Why? Because awareness is low, eye hospitals are far from the most vulnerable patients, and there aren't enough ophthalmologists. But what if we could make eye care accessible, affordable, and able to be done by anyone, anywhere? That is our mission at Visilant. We developed a low-cost smartphone imaging system that anyone can use to capture clinical-grade eye images. Our AI runs directly on a smartphone to diagnose conditions like cataract and infections with 95% accuracy. It's trained and validated in the communities we serve. When an expert opinion is needed, ophthalmologists can review the image remotely. Then we connect patients with in-person eye care. We provide education about their disease and share reminders to follow up. Thanks to Visilant, rural patients who used to travel hours for eye care can now access highly specialized eye screening close to home. No more delaying care, missing work, or spending wages on follow-up. In a 1,200-patient study at Aravind Eye Hospital, we showed diagnosis with our images is comparable to an in-person eye exam, that health workers can learn to take images in 30 minutes of training, and they say it makes their jobs easier. We started Visilant during the pandemic, when outreach shut down and millions lost access to care. Thankfully, community members stepped up and started taking pictures of their neighbors' eyes and sharing these with Aravind Eye Hospital. Since then, we've co-developed the solution with our partners in India, guided by the insights of hundreds of patients, health workers, and clinicians. We've now screened over 30,000 patients and connected them to vision-restoring care. We partner with charitable eye hospitals, foundations, and governments. Our tools make screening more efficient and affordable so they can reach more patients. And crucially, we work with partners who ensure every patient screened receives care. My name is Jordan. I'm a biomedical engineer and computer scientist. I've spent the last decade leading global health projects and building digital health solutions. My amazing co-founder Nakul is an ophthalmologist and epidemiologist at Johns Hopkins. Growing up in India, he started volunteering at eye camps as a teenager, and he makes sure our work is rooted in evidence and clinical practice. My other co-founder, Kunal, is a serial entrepreneur who spent the last 10 years working with India's eye care systems to bring accessible solutions to market. We are so grateful to be a part of MIT Solve as we work to bring sight-saving care to 1 million patients over the next 3 years. To make this happen, we're seeking expertise in implementation, sustainability, and engaging with ministries of health. If this sounds like you, we'd love to connect afterwards to explore how we can bring sight-saving care to those who need it most. Thank you so much.